Hello, my name is Dr. Abraham Wai from the Department of Emergency Medicine and the University of Hong Kong. I recently published a paper entitled Effectiveness of Antivirals, Nirmatrelvir-Ritonavir and Molnupiravir in Viral Sepsis, retrospective cohort study in JMIR Public Health and Surveillance. In our paper, Effectiveness of Antivirals, Nirmatrelvir, Ritonavir, and Molnupiravir in Viral Sepsis, we address a crucial clinical challenge: how best to manage sepsis caused by viral infections, particularly in the context of COVID-19. Viral sepsis is frequently overlooked, and treatment guidelines remain poorly defined, most recommendations being extrapolated from bacterial causes. To shed light on this gap, we conducted a large retrospective cohort study using the Clinical Data Analysis and Reporting System in Hong Kong, comprising health data from all public hospitals in the city. We identified over 15,500 adult patients with a mean age of 75 who were meted with COVID-19 between February 2022 and June 2023. Importantly, all included patients had negative blood cultures, ensuring we capture true cases of viral sepsis without secondary bacterial or fungal infection. We categorize patients by the presence of organ dysfunction, such as respiratory failure, acute kidney injury, coagulopathy, or circulatory shock at hospital admission. Employing propensity score matching for robust risk adjustment, we compare outcomes between those who received Paxlovid or Molnupiravir and those who did not receive any viral treatment. Our primary outcomes were in-hospital mortality and length of hospital stay. The findings were compelling. Both antivirals were associated with a significant reduction in the risk of death, particularly in patients who did not have organ dysfunction on admission. For instance, the risk of death fell by 83% for Paxlovid users compared to controls in this group. Molnupiravir also conferred clear survival benefits, even in those with certain forms of organ dysfunction. In addition to reducing mortality, both antivirals shortened hospitalization. Notably, Paxlovid reduced length of stay by more than 3 days for those with respiratory failure, and by over 7 days in those with acute kidney injury or coagulopathy. Molnupiravir showed similar benefits, particularly in acute kidney injury and coagulopathy. Our study thus confirms the effectiveness of these oral antivirals in improving survival and accelerating recovery for patients with severe COVID-19 complicated by viral sepsis. These findings directly inform clinical practice, supporting the prompt use of these agents even in older and frail populations, and providing new evidence for shaping local and international guidelines on sepsis management in the post-pandemic era. We chose to submit our research to JMIR publications because of its strong reputation in disseminating open access, high-impact public health studies to a global audience. JMIR's editorial standards and commitment to digital innovation align closely with our aims of sharing real-world health systems research that informs current clinical and policy practice. The journal's focus on public health surveillance made it a natural fit for our work, and we value its accessibility for clinicians, researchers, and clinical makers worldwide.